Good afternoon. Since Tuesday, May the 26th, we have seen an 11% increase in confirmed COVID-19 cases here in Baltimore. As of this morning, the city has 5,426 reported cases, 368 people hospitalized with COVID-19, and 240 deaths. I'm up here as much as possible to ensure our residents have the most up-to-date and accurate information, so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. And now we have added a tab on the left menu for residents to find testing locations. After consulting with our health commissioner and reviewing Baltimore City's health data on COVID-19, we will move forward with allowing outdoor dining. Yesterday, I announced that restaurants with outdoor dining permits can begin serving patrons outside only, beginning today at 5 p.m. Restaurants that are already permitted for outdoor dining can begin serving meals outside today at 5 p.m. And restaurants that do not currently have outdoor seating permits can begin applying for a permit at 9 a.m. on Monday, June 1st. In keeping with the governor's order on outdoor dining, all restaurants must ensure patrons are appropriately distancing with no more than 6 people seated at a table, with the exception of members of the same household. Ensure patrons are seated at least 6 feet away from each other, except for households seated together. Use single-use disposable paper menus or sanitize reusable menus between each seating. Sanitize outdoor tables and chairs between each customer's seating. Train staff in current COVID-19 health and workplace guidelines. Begin screening procedures, including daily temperature checks of all staff. Ensure staff wear masks or face covering when interacting with other employees or patrons. We believe that if these protocols are strictly followed, outdoor dining can occur safely. I want to thank all of our business owners and restaurant employees for their patience and continued adherence to the use of social distancing and face covering as we allow for this next step in our reopening. Additionally, I've tasked Baltimore City Recreation and Parks with the reinstallation of nets at city-owned tennis and disc golf courts. Both tennis and disc golf courts require low to no contact and are safe to play while maintaining social distancing guidelines. Players are strongly encouraged to adhere to the new guidelines, which can be found on the Recreation and Parks website and at each court location. Those looking for additional recreation options while maintaining social distancing should visit Baltimore City Recs and Parks virtual rec. So I want to be clear that Baltimore City is still under a local stay-at-home order for Baltimore City. We have just loosened some restrictions to help our residents, small businesses, and restaurants. This means that all residents should still remain at home unless they have to go out. I know I probably sound like a broken record because I keep saying the same message every week, but it's that important. If you must go out, everyone should be wearing a face covering. This covering is to protect everyone you come into contact with. And again, I want to thank the majority of Baltimoreans who have heeded the warning and followed the guidance. Next, on behalf of the City of Baltimore, I want to sincerely thank our sister city, Xiamen, China, for their generous donation of 50,000 masks to Baltimore City. I want to thank our sister city committee for all their hard work in coordinating this donation, especially Committee Chair Cindy Wang. Today's gift will go to the city stockpile of PPEs to be used for first responders and city employees as we prepare to bring more employees safely back to work. Before I bring up our health commissioner, because I know she will also touch on this also, we're entering the hottest months of the year for Baltimore City. Health-related deaths are preventable, and I need everyone in Baltimore to work with us to ensure every resident is safe, especially during this pandemic. Stay hydrated and be mindful of how you feel when you're out in the sun participating in outdoor activities. And please seek medical care if you do not feel well. Most importantly, check regularly on family, friends, and neighbors who do not have air conditioning and who spend much of their time alone. We especially want to reach out to our seniors and other vulnerable population who are most at risk during these events. To assist with the heat this summer, the Baltimore City Health Department Division of Aging received $1.2 million from the federal government's CARE Act. This funding will assist Baltimore's most vulnerable residents to stay at home during COVID-19 pandemic and stay safe during possible code red days. In partnership with the Baltimore City Department of Housing and Community Development and nonprofit partner Civil Works, the Baltimore City Health Department's Division of Aging will work to identify residents in need of this program. The Department of Housing and Community Development will assist with the install of 1,200 air conditioning units, and Civic Works will assist with the distribution of over 25,000 fans to Baltimore's older adults. The Mayor's Office of Children and Family Success is also partnering with the Health Department to assist residents who qualify for this program in completing energy assistance application so that no one who is eligible for this program will have to worry about how to pay an energy bill while staying cool during Code Red. The goal of this program is to have air conditioning units and fans distributed to cities' older adults prior to the city's first Code Red heat day. Older residents or caregivers of older residents may call the Maryland Access Point at 410-396-CARE or 410-396-2273 to see if they qualify for this program. Now I will ask Baltimore City's Health Commissioner, Letitia DeRosa, to update you on our COVID-19 response and our work to support the residents of Baltimore City.
Thank you, Mayor Young. As Mayor Young indicated, today marks the beginning of the 2020 Code Red Extreme Heat season in Baltimore. A Code Red Extreme Heat Alert is issued when the forecasted heat index is greater than or equal to 105 degrees Fahrenheit. Heat is one of the leading weather-related killers in the U.S., resulting in hundreds of deaths and thousands of illnesses every year. During the 2019 season, Baltimore City experienced several heat waves across June, July, and August, with 16 official Code Red extreme heat days. To stay safe during the hot summer months, here are some things to remember. Please stay indoors if possible in air-conditioned spaces, especially when it's hot. Drink plenty of water and be sure to avoid alcohol and caffeine. Eat well-balanced light and regular meals. Watch how much salt you put on your food. Do not ever leave children or animals in a parked vehicle, even if for short periods of time. Leaving a window open is not enough. Give pets plenty of fresh, cold water and protection from heat and sun, as pets can also suffer from heat-related illnesses. Keep a wet cloth handy to cool off your skin. The summer months are also a great time to be a good neighbor. Be on the lookout for anyone who might need help. Children, older adults, people with chronic medical conditions, as well as people without shelter or without electricity, are all at increased risk during extreme heat events. During the 2020 Code Red extreme heat season, the City of Baltimore is making modifications to its cooling center plans in light of the COVID-19 pandemic. As long as it is safe to do so, the city will open cooling centers on Code Red extreme heat days. A full list of cooling centers and the hours of operation are available on our website, health.baltimorecity.gov/coderedinfo, or by calling 311. Transportation to and from cooling centers is available for older adults age 60 and over, as well as adults under the age of 60 with disability through the CARE Taxi Card program. Those using the CARE Taxi Card program must have already been pre-enrolled to utilize this service. For more information, please call 410-664-1123. If you do plan to visit a Code Red cooling center on Code Red heat advisory days, as mentioned previously, we're supporting our cooling centers to abide by appropriate social distancing guidelines. Therefore, space may be more limited than it has traditionally been in the past. Please remember the following. If you are ill, please stay home and contact your healthcare provider. Call your regular cooling center prior to arrival to ensure there is space at your preferred location. Wear a face cloth covering and maintain social distancing while at the cooling center. As always, please continue to practice good hand hygiene and avoid touching your eyes, nose, mouth, or face. Thank you.
Thank you, Dr. Devasa. I will take a moment to address the horrific killing of Mr. George Floyd at the hands of police officers in Minneapolis. No human deserved to be treated the way Mr. Floyd was treated, repeatedly begging for his life. Commissioner Harrison has addressed this death, and I support his previous statement 100%. In Baltimore, we are committed to carrying out the structural reforms for our own police department that began when I first became, began when I became the first elected official to call for a Department of Justice investigation into our own police department. We're making consistent strides at reform. I know that the majority of the men and women of the Baltimore Police Department are outraged by the killing of Mr. Floyd. Locally, we are more committed than ever to creating an equitable police department that our residents deserve. And with that, I will bring up Commissioner Harrison.
Thank you, Mr. Mayor. As I stated earlier in the statement, the killing of George Floyd at the hands of law enforcement is both deeply and horrific and heartbreaking. What we saw in the video was disturbing and shocking to the conscience. So following the events across the nation from yesterday and today, the Baltimore Police Department has been creating a contingency in the event we have to deploy resources to allow residents to exercise their First Amendment right and then to keep them safe as well. This contingency includes small and large gatherings, short-term and long-term demonstrations. The department is in constant contact with our local and state law enforcement partners, specifically the Maryland State Police. We continue to further our coordination and our conversations this evening, tomorrow, and further and beyond as we prepare to safeguard those who wish to peacefully participate in exercising their constitutional rights. The Baltimore Police Department remains committed to rebuilding and earning the trust of the communities we serve through fair, equitable, and dignified treatment of all in our fight for justice. I stand with the leaders from across this country and our communities to call for these officers to be held accountable for their abhorrent actions and for justice to be served.
Thank you, Commissioner Harrison. As we all watched Minneapolis burn last night, it was a stark reminder of our city's own trauma. That is why I signed the Elijah Cumming Healing City Act into law. And that is why today I'm announcing a new COVID-19 coordinated mental health recovery effort to combat the impact of stress and trauma caused by the coronavirus pandemic. And I'm honored that Councilman Zeke Cohen, the sponsor of the Healing City Act legislation, will lead this new initiative. Baltimore will not wait for the end of the pandemic to begin our mental health recovery. It is essential that we provide residents the resources to cope and recover during this critical time. We understand trauma is real in our city, and we will address it head on because that is the only way we can truly continue to build Baltimore. This new initiative will seek to expand access to mental health resources, map and connect institutions, providing resources for healing, and provide pathways for individuals to get involved and support each other. And now I'll bring up Councilman Cohen to talk more about the initiative.
Let me begin by first thanking Mayor Young and his team, Commissioner Jaraza, for having the insight to know that when we are facing this pandemic, the impact is not just going to be on our city's physical health, but on our mental health as well. We know from previous pandemics that the mental health impacts can be up to 25 times more debilitating than the physical health impacts. And we are seeing that here in Baltimore, a city already beset by trauma, already struggling with violence, already dealing with harsh segregation. We are seeing firsthand the mental health impacts of this pandemic. We see it for seniors who are stuck and isolated, who may be living in nursing homes with other seniors where they fear getting the virus. We see it with children who are out of school, who may lack the structure that they had during regular times. And particularly, we see it, one statistic I heard from our police department is in the last 3 months, compared to these 3 months in 2019, reports of child abuse have dropped dramatically. We're at about 1/3 of the reports of child abuse for this 3-month period as we had in 2019. But we know that child abuse is not down. In fact, it's up. We know that children who are stuck in homes often don't call 911. And so we are seeing the impact on our seniors, on children, on people who have been out of work, who have lost their sense of self-worth and dignity. And I think it's important to recognize, and Mayor Young said it, and Commissioner Harrison said it, the incredibly traumatic impact of systemic racism in our country, in our city. We know the names George Floyd, Ahmaud Arbery, Breonna Taylor, but we know how they died. We don't know how they lived. The fact that we continue to see videos and that people of color, black folks in our city, continue to see these videos of people being killed is in itself traumatic, is in itself work that we are forcing people to do, to relive over and over and over again. And so any solution that we come up with must acknowledge that racism in this country is a public health crisis, and it must be dealt with head on. Today, we're going to talk, some of the folks are going to talk briefly about some of what we hope to see through this mental health recovery effort. But I will simply say this. One, it is critically important that we have this conversation in public. Mental health is too often stigmatized. I see it myself in my own family. I feel it myself as I go through waves. I'm up, I'm down. In this moment, it's been particularly tough, but we need to have these conversations out loud. We need to be honest with ourselves about what we are dealing with. We need to make sure that in a city with so many institutions, be it Behavioral Health Systems Baltimore, Roberta's House, Healing City, all of the great healers that we have in Baltimore, that we're connected, that we're not doing work in silos, that we're working in partnership. And so through this initiative, we hope to do resource and asset mapping. Finally, we need to make sure that if folks need support and need it now, that they have access, that we are creating a continuum of self-care for people in Baltimore. And also, we know that one of the most healing palliative medicines that we have is each other. And in a city that is so scrappy and so compassionate, we know that we need to be there for each other. And so I am truly honored that Mayor Young would name me for this effort. I know that we will do it in broad and shared partnership. And I want to call up Dr. Melissa Buckley, professor at Coppin State.
Good afternoon. Thank you so much. Yes, I am Dr. Melissa Buckley, faculty member at Coppin State, but I'm Melissa, who, much like Councilman Cohen said, have been experiencing the ups and the downs. Just this week alone, it has been horrible. And I have been on a Zoom call this week where I broke down crying. So this is a lot. And this is why we need this mental health recovery initiative. As a member of the Healing City Baltimore Steering Committee, I am, of course, committed to this movement towards healing. And so I feel very strongly that this initiative that we are starting today, with everybody's participation and engagement, will get us to that destination that we are hoping for. We are all dealing with the realities of our own mental health being taxed, particularly in the midst of this pandemic. And so we have to be proactive at engaging together, shoulder to shoulder with social distancing as community members to work towards this mental health recovery.
Thank you, Dr. Buckley. It's now my honor to call up Pastor Jim Hamilton from Breath of God Church. I'm sorry, Church on the Square. Got my churches mixed up.
Good afternoon. I'm Jim Hamilton from Church on the Square in Canton, in Southeast Baltimore. And I am grateful to Zeke Cohen for noticing, along with other pastors, I'm sure that Pastor Daniels would agree with me, that we noticed early on that one of the psychosocial impacts of this COVID-19 disease was that people that were elderly, our wisdom keepers, our storytellers, were disproportionately at risk for this disease, and therefore disproportionately at risk for the psychosocial impact of the power and the sadness of being restricted from many of the institutions that they used, libraries, senior centers. They could not connect with all of their circles to find support. And so in doing that, we realized that they would be sitting and counting the days. I just visited a HEPA senior housing on Boston before I came over here, and I spoke with one of the residents who said that everyone in there is enumerating the days that they're sitting and being alone. Some of my members in my community have enumerated the days since they've physically touched another human being. And how that impacts us in our body and our soul is that we have lost contact. And beyond that, in the news, they are hearing that they are dispensable. They are hearing that there is an acceptable number of losses, and that has an impact on us all. And so when I talked to Zeke, I said one of the hidden impacts of this disease would be how despondent and disconnected our seniors would be. And together with other wonderful organizations, we've built something called Baltimore Neighbors Network. It's seniors being reached out to by citizens like you and me. Not necessarily people that have the training, but people that are neighbors, and we give them the resources they need to know how to start and maintain good conversations, to let people know that we care about them, that they are valuable to us. If you go to baltimoreneighborsnetwork.org, you will find an easy process to sign up, to learn how to call these individuals, and to create good network connections. Now you see, I've also talked to the volunteers, and they're greatly impacted emotionally by their connections. Last night, one of the volunteers said to me that she was in tears after talking to a friend, a new friend, a senior that she reaches out to, and realizing that he is not alone, but also that she is not alone. Baltimore is strong. As Zeke said, we're scrappy. And it's in these times where we create new ways of connecting, new senior centers on the phone. And by connecting, we stitch our neighborhood back together. Thank you.
Thank you, Pastor Jim. You've heard from a social work professor, you've heard from a pastor, now you're going to hear from a pastor and a social work professor, Dr. Kevin Daniels.
Good afternoon. One of the, even as the mayor talked about my job, and as we work together, begin to work together to stitch, as Pastor Jim said, and pull things together, not only mapping, but also connecting organizations for mental health care and coordinating those services, particularly with the faith institutions, clergy. I'm also not only a pastor, as he said, but also the chair of the Civic Action Committee for the Ministers' Conference of Baltimore and vicinity. And the reason that this is important, that we continue to come together and work together, as we've already said, and we've already set in motion, is that faith institutions are embedded within the communities that they both serve, and they serve as hubs, working with those communities and other anchor institutions within those 14 districts across Baltimore City. And we will be working together for not only to provide resource, but also care and connection throughout not only the tenure of this process, but even well beyond. And we've already set that in motion, even in working with the mayor in order to do that. And while this crisis, while it is devastating to all of us, it has also provided us an opportunity for coalition building and collectivism as a city and in a city that all of us continue to love. God bless you.
First, I want to thank Councilman Cohen. I want to thank all of you who have come up to speak for all the great things that I'm looking for you to do in order to heal our city. At this time, we'll take a few questions.
Good afternoon, Mr. Mayor.
Good afternoon.
I know you mentioned it earlier, but if we could review really quickly with you and the commissioner regarding the incident in Minneapolis. You said it reminded you of our own trauma. Can you elaborate on that?
Well, you know, what happened with Freddie Gray, it reminded us of the same type of situation that took place. And as you know, some of our protesters took to looting and burning establishments, which I don't condone. I mean, we could express ourselves in other ways, being more civil and, you know, not destroying things in our own neighborhoods and our own communities. But when I seen it, you know, it just sent chills through my body being a black man who could be mistaken if I'm going somewhere in another city for, I mean, you walk down the street and you meet a certain description and, you know, it could happen to me. So I'm concerned about my own male members of my own family and of young black boys here in Baltimore. And that's why I was one of the first elected leaders to call for the Department of Justice to look at our own police department. And I think our police department is making great strides. You know, we're working through this consent decree, and we have community members on that that's working through the consent decree. And I just don't want to see what's happening in Minneapolis to be happening here in Baltimore. I know protesters are going from city to city, but if they come to Baltimore, I'm hoping they come peacefully, without, you know, committing any rioting or burning down, you know, stores and things of that nature. I'm just hoping, because everybody have a right to protest, you know, and to destroy property and things of that nature is just totally unacceptable. So I'll just leave it at that.
Thank you, Mr. Mayor. Mr. Commissioner, in speaking to these protests, we're monitoring social media at the moment. And are you aware that there's a call for local protests kicking off at 6 p.m. downtown here tonight? What can you tell us about that, if you know? First of all, are you aware of that?
We learned about it today.
Okay, what's your reaction when you hear that there are planned protests regarding what's happening in Minneapolis? We've seen how those protests have gone in other cities. What's your reaction when you hear that there are planned protests for tonight happening here? Many of them say they'll be starting in downtown and marching to our police precincts.
We learned about it today, and we've been working over the past couple of days to create a contingency to deploy resources to allow people to demonstrate and to protest peaceably, and to help them actually protest while keeping them safe and keeping everyone else safe. That's our duty, and that's what we're sworn to do. And so I just got off a call with the Major Cities Chiefs Association, which makes up the 70 biggest cities in America, and all of us are facing the very same thing. And so in a very coordinated way, we're all working to make sure we allow people the space and place to protest and to exercise their First Amendment right, keeping them safe and keeping everyone else safe. That's what our planning is all about. We are aware of it, we're prepared for it, and the one thing we urge is that we want people to do it peacefully. Thank you, sir.
Just to follow up with that, obviously you weren't here in 2015. Does the department have a clear strategy for dealing with a protest that, you know, might get overheated, to try to contain that in a peaceful manner that may be different from what the strategy was in 2015?
First of all, while I wasn't here in 2015, I was the chief of New Orleans, and I sent 2 SWAT lieutenants who were embedded with Prince George's County, who stayed on the front lines here for 7 days, and they came back and built the New Orleans plan to deal with protests. So I'm somewhat familiar with it, though I was not here. But yes, we are prepared for it. We have been planning, and there is a contingency, as I stated earlier, for small and large demonstrations, short-term and long-term. And we have been in contact with the state police throughout the day. We have further communications after this press conference, and we're in touch with the Maryland National Guard by way of the state police, should we need them for any prolonged demonstration that should go beyond our capacity. But certainly, we've been planning and prepared, and yes, there are lessons learned from 2015 that would allow us to be able to be safe and to keep everyone safe, both people and property.
Mr. Commissioner, what kind of guidance are you giving officers about this specific kind of demonstration, and does the coronavirus pandemic change the way you're advising them to behave?
Well, coronavirus changes everything. However, we have, even early in, I believe it was early March, we began retraining and giving updated training courses to many of our mobile field force officers in the event we had to have this, not necessarily because of the events of the country, but because of the scarcity of resources which people would inevitably begin to compete for. And so we started that training back in March. Though we didn't get to train everybody, we started it. So we are prepared, and we have plans in place, and we're perfecting those plans throughout the evening and today, should we need to include our state partners and other local partners to help us for a prolonged event.